Please can you present your findings?
This lady has autosomal dominant polycystic kidney disease. The clinical signs are bilateral blottable masses in the flanks, which I am able to get above. She has no evidence of renal failure, she's euvolemic, and she has no evidence of current or previous renal replacement therapy.
How might patients with autosomal dominant polycystic kidney disease present?
They may present with hypertension, they may present with the signs and symptoms of renal failure, or it may be detected on blood tests. They may present with proteinuria or hematuria, or they may also present with symptoms associated with the extrarenal manifestations of polycystic kidney disease, such as cysts in the liver or pancreas.
Can you tell me any more about the inheritance of PKD?
It's an autosomally dominant condition. There are two main genetic mutations that are associated. Around 80% of patients have a mutation on chromosome 16, with the rest mostly having a mutation on chromosome 4. There are also a small amount of patients who have no detectable genetic abnormality.
Do you know of any differences between each inherited type?
The latter type, polycystic kidney disease type 2, which is associated with a mutation on chromosome 4, tends to be less severe, with later onset, less cysts, and a later progression to renal failure.
How would you treat someone with PKD?
The management is multimodal, with good control of blood pressure, ideally with ACE inhibitors, very important. There should also be aggressive control of hyperlipidemia, and patients should be on a high fluid, low salt diet. In the early stages of the disease, vasopressin receptor antagonists may be of use, whilst later on in the disease, as the renal failure progresses, the patients may require renal replacement therapy and or transplant.
What are the extrarenal manifestations of the disease?
As mentioned, these patients often present with hypertension. They may also present with cysts or symptoms of cysts in other organs, for example the liver, the pancreas, or the seminal vesicles. Probably the most significant extrarenal manifestation is the risk of cerebral aneurysms, which may present with intracerebral hemorrhage or subarachnoid hemorrhage. Patients may also present with colonic diverticulae.
Do you know of the indications for a nephrectomy of a polycystic kidney?
Ideally, in these patients, nephrectomy should be avoided. However, at times it may be required. One indication is to make room for a transplanted kidney if a donor becomes available and the patient's on the transplant list. Other indications would be progression to renal cell carcinoma, chronic pain, chronic infection, or large and significant hematuria.
Would you always need to perform a nephrectomy prior to transplantation?
You do not always need to perform a nephrectomy, and ideally the new kidney will be transplanted in with both of the old kidneys left in place. However, on occasion it may be necessary simply to make room for the new kidney.
Okay, thank you very much.
Thank you.